to our esteemed clients, partners, Capgemini leadership and colleagues. Thank you for blocking your calendar and joining us for the Applied Innovation Exchange-led Go Live session. Hello, my name is Suvarna Goyal, and I shall be the anchor for this session today. Before we go any forward, let's share the session flow with all our audience. The session is going to unfold as follows. While I will be giving all our audience a high-level introduction to the topic of the session, that will be followed by a context building and introduction to AIE by Nishit Srivastava, which will then be followed by the first speaker, Dr. Jayanti, and one of our other speakers, Mr. Anupam Chatterjee, followed by a question and answer session and the closure of this particular webinar. Before we go any forward, wanted to let our audience know the current environment in which we all are as of today, due to the extraordinary situation which we have witnessed unfolding for the past few months and have been impacted by the same to a large extent. The perception of business as usual and the future scope of techno-business realities have altered a great deal. This has ushered in new conversations on contactless consumer experience in healthcare, which also interestingly has far-reaching effects across sectors and domains. Having said that, I'd be very happy to introduce our esteemed speaker and panelists, who will be as follows. It will be Mr. Nishit Srivastava, the Chief Technology and Innovation Officer, Capgemini India. Second panelist and speaker would be Dr. Jayanti Subramanian, Vice President, Market Solutions and Strategies, Healthcare, Capgemini Financial Services, and Mr. Anupam Chatterjee, Founder and CEO, Sempia Patient Experience Management Platform. The eminent speakers are going to take us through a fantastic piece around the topic, Maslow's Hierarchy of Customer Experience, digitally enabling a sentient healthcare consumer experience. The entire session has been put together in a particular call-out called Go Live session, which is a channel to stay connected with the most important emerging technologies developed around the globe through virtual interactive conversations with our client prospects and ecosystem partners and internal SMEs. While we have unfolded and executed about 15 odd Go Live sessions across the globe, this is the 16th edition of the same, and we are very happy to have all of you join us for this particular session. Without much ado, I'd like to now pass this baton on to the first panelist speaker, Nishit Srivastava, to take us forward. Nishit, all yours now.
Thank you, Suvarna. Quick check, I'm audible, right? Okay, I take that as a yes. So thank you so much for that introduction. And, hello, everybody. A very, very warm welcome to all of you to this talk. It's a privilege. It's my privilege to introduce our innovation framework to the August audience on the session. Now, you've got the slide in front of you, which talks about the Applied Innovation Exchange. And I thought I'd just take a few minutes trying to explain to you what it's all about. So the Applied Innovation Exchanges, or the AIE, is Capgemini's global platform to foster co-innovation with our clients frugally, rapidly, and at scale. And quite literally, it translates to a mechanism by which creative disruption can be analyzed in the context of our client's business, as well as the competitive landscape, co-creating innovative ideas and frameworks in a manner that can be applied to produce business results. Frequently, this also includes embracing our innovation approach, the open innovation approach, with our ecosystem partners like startups and academia, to ensure that the best ideas can be collated from both inside as well as outside of the organization. And this includes cross-sector as well, okay, which effectively all of these together goes well with the theme of the exchange in the Applied Innovation Exchange. A long sentence, I know. So in simple English, AIEs are where deals get done. Okay? Clients get to see how we cross-pollinate learnings and best practices from analogous contexts that brighten up even the most uneventful of application or platform management or maintenance environments too. Okay? And we get to interact with our clients on issues that really matter to them across the business organization. So we'll move on to the next slide where we'll talk a little bit about how the network spans the globe. What you see in front of you, many of those beautiful dots that you see, are all our points of presence globally. Okay, the red ones are those that have been in existence. The green, the fluorescent green ones are the ones that are due for launch. Actually, Shenzhen, as we speak, was launched just a couple of days ago. Sao Paulo is in the works. And this is the current strength of the AIE network. Okay, we're closing on 20 exchanges globally. And the cool thing is that, like all great cuisines, each of these AIEs have a local flavor to them, right? And that's why the structure exists. It works best for the local client ecosystem. So, for example, AIE in Toulouse in France is absolutely world-class on avionics and aerospace, collaborating closely, let's say, with the AIE in Utrecht, okay, which is absolutely cat's whiskers when it comes to quantum computing. Related business use cases like, say, like connected supply chain, for example, which has become really relevant in these times. Even cooler is the fact that we use a proprietary mechanism of AI's digital twinning that, in a way, mutualizes and enhances, of course, the overall capability spectrum of each of these AIEs, thereby bringing the best we've got globally to every local point of our presence in a location agnostic way. So I understand that sounds paradoxical, but yeah, so that's what we've done. And therefore, our customers, their globally dispersed teams and functions, have the flexibility to seamlessly continue conversations with us locally everywhere without missing a heartbeat. Yeah. In India, closer home, we have had the AIE Mumbai for about 4 years now, and recently we launched AIE Hyderabad during this lockdown period. And the great thing is that we've actually already anchored, virtually speaking, many client engagements already. Okay, and with that, let me give you a glimpse into how we conduct our business in the AIEs. Okay, on the next slide, which will come up now. You see the 4 corners, clockwise top left: discover, devise, deploy, and sustain. Right? DDDS. Now, the framework is structured in a manner you have to appreciate. It's not a sequence. It's not necessarily. It is a journey, but a journey where our clients engage with us in any combination, in whole or in part, in the beginning, midstream, or at the end. But what do they really mean? So I'll try to explain them very, very quickly. Discover is where our clients engage us around what they wish to accomplish. Okay? New business models, for example, as inspirations from sectors outside of their native one, for example, in order to circumvent the pitfalls that they anticipate experientially. Now, that's counting for a lot, right? I mean, the real-time pricing in one sector could be a new idea, whereas it may have been in existence, having gone through the whole journey in another sector, in another context altogether. And, those kinds of things are what we do in these Discover sessions. So together with clients, we discover relevant innovations, sector pivots, explore new business models, identify business problems, immerse in emerging technologies, and define, for example, action plans to drive the change they either seek or discover along the way during their journey with us in such an interaction. Okay, so now we've perfected this in many varieties or formats, not limited to the usual ideation workshops that you will find everywhere. And these are actually quite inspiring, so I would strongly urge you to engage us there. So that's the discover part. So very quickly, briefly, devise the next top right corner is a rapid build and co-creation of, let's say, proof of values and concepts. And this is where you carve out the sculpture or the artwork you had in mind, using emerging technologies, platforms, and the ecosystem as the tools, and getting your hands on, okay, to give it the shape you have in perspective. Bottom right, deploy is, really once you're convinced of the innovations you've tested and mitigated, the related deployment risks, we help you deploy these innovations with speed and scale and with certainty, trust and intelligence. Lastly, the sustain. I can't forget that once you've deployed solutions, you have to keep an eye out for two things, okay, with regards to any innovation. One is the revalidation of expected impact at predetermined intervals, right? There was something that you had in mind, it's been deployed, are you sustaining that? Okay? And therefore, point two is ensuring continuous touch points with the client program teams to ensure sustainability of all that was imagined during the design phase. Remember, neither the client nor the innovation partner can expect to embed innovations as a culture unless there is a repeatability, okay, in what to do. Now, I hope this brief set the tone for the coming up now, which is Maslow's Hierarchy of CX. And with that, I'm very pleased to pass the baton on to my colleague, Dr. Jay, with a very, very warm welcome. Pleasure to have you with us, Jay.
Thank you, Nishit. That was so wonderful what you had just shared. Hello to all. The what you talked about, quantum computing or digital twinning, when I hear all of these exciting technologies and the advanced technologies, how they make a big difference to many of the sectors. And right now, with healthcare, we are at that inflection point where there is a very urgent demand given this COVID situation, as well as there is a rapid need for rapid scaling that needs to really happen quickly. We are very receptive to the use of advanced technologies. With that, I'll just move on to the next slide, and then I'll talk about why we chose today's topic, and then we'll talk about the context for it. So today's topic, the whole digitally enabling ascension. The key word here is sentient. The reason we chose this word is as we experienced COVID, specifically for those patients that were in the hospital, afraid, fearful, quarantined, in isolation, or those patients who felt like maybe they have a condition and they needed to see the doctor, they were afraid to go to a clinic. All of the experiences the patients or the consumers have had in the last several months have led to one big need, one big conversation around the experience was not satisfactory. The telemedicine was okay. I didn't feel like the doctor was able to see me well. I don't think I got the kind of care I needed. These are the kind of conversations you heard, or we all heard. And I personally experienced a televideo call, and I can say that it's really not the same as touching and face-to-face human interactions you have with your caregiver or care provider. I'm a care provider clinician myself, and it's very hard to wrap our brains around doing this differently. So consumer experience in healthcare has really, it has taken a trajectory on its own. So we decided to kind of bring this topic around, very specific to what that would mean, as well as what are the, Anupam is going to talk after me about how it translates into the products he has designed through his company. So with that, we will quickly move on. So today's topic, the way we are going to flow through this is, I'm going to quickly touch upon the healthcare trends and what that means in the post-COVID world. So we're going to talk about the consumer experience a little bit more and how ready we were, how ready we are, and how ready we need to be in the post-COVID world. And then Anupam is going to walk us through some of the digital platforms and technologies he has brought about and has been very creative, specifically with the use of conversational AI in his platform. So he's going to talk about that. He's going to talk about how he has applied it in healthcare. And then we are also going to touch upon how it applies to other industries, such as banking or retail or hospitality, which right now is at a pause. But then we're going to talk about it because that's, it's not that it's going to be the end of it all. Everything is going to emerge back. And when they do, we're going to have to do the business in a little newer way. So with that, can I move on to the next slide, please? Okay, so this slide is all about the journey. So, when we all read about banking or retail, we all have this experience that, technology is really ahead. The kind of discoveries they make, the kind of innovation they bring, the way we experience digital shopping, evolving from retail stores to Amazons to, humanless stores for Apple, so on and so forth. Or in banking, how we don't even need to deposit a check anymore. We can just scan it and it gets deposited. So the kind of innovation and the advancement of technology in these two industries has been phenomenal. But in the healthcare, everybody keeps complaining that it's in the 70s, it is in the 80s, and we are not really moving forward. And we all wonder, why is that? The one big reason for that is in banking and retail and all these industries, the consumer demanded that there will be better technologies, better innovation, better experience. That was the big demand. In healthcare, no patient will go and ask a provider or a doctor, do you have a better EHR? That's not the criteria for them to see the doctor. It's always about, is this doctor a good clinician? Can he diagnose me well? Can he treat me well? So that is the reason in healthcare that adoption of technology never really took off for a long, long time, up until recently. So if you really look at this journey, we start from the A, B, C, and D. So when we first started the whole adoption of technology, and I still remember about 15, 20 years ago, it was all about somehow, somewhere, we need to have some sort of a practice management software that can maybe connect few things together. Maybe we know how many patients we need to see. Maybe we know what we need to bill for the patients to the insurance. It was just about really creating those kind of practice management or electronic health record at the back end, really creating some workflows that can be digitally or technologically enabled, assembling workflows. Then as we moved on, we started doing that at the back end in the back offices. We realized that we needed to exchange the data. So that's when we realized, okay, now I have got all my processes sort of automated or sort of towards automation, or I've got some system going on. But then if the patient went to some other physician or some other care provider, I don't have access to that data unless they physically fax something to me or bring it in their hand, a piece of paper. So then we realized very quickly we need to become a little bit more better in the way we structure our data, in the way we exchange our data, the way we exchange information. That led to the whole interoperability story. So if you really look at healthcare, even today, you've got different providers using different ontologies in healthcare to document what they do. It's not very standard. It's not, everybody doesn't document it in the same way. So it's very hard to exchange the data. Another big problem in healthcare, including me, is the lack of standard abbreviations. So we all use shorthand, and sometimes we consider that the abbreviation. Unless you are from healthcare, nobody else knows what you're really writing sometimes. So these kind of non-standard ways to really document, whether electronically or manually, has led to the interoperability challenges. So it's critical that, oh, there is a noise in the background. If somebody can go on mute, please. Okay. So that led to the whole data exchange. So we started exploring data exchanges, and as you can tell today, we are a lot more mature in the interoperability data exchange conversation. These all led to creating trust. Basically, cybersecurity, data privacy became a big conversation, and this has been on for many years. Whether it's HIPAA or high trust, we are emerging and evolving in that cyber and data trust space, and that's also been part of the healthcare. So all of these have taken on over the years, but in a very gradual manner. When we go on to D, which is drive digital access on the left-hand side, is where we really saw over the last few years, about 5-6 years, then the patient really started saying, I don't want to go to a doctor's clinic and wait for, an hour. It's a waste of my day. If you have a schedule, I will book it online, and you tell me 20 minutes before it takes me 20 minutes to drive up to the doctor's clinic, I will show up there. So that became a big important area for us to kind of move towards. Then patients and consumers wanted to do billing online, pay things online, or to know what is it that I'm paying for? What care did I get? Did I really get the care the doctor said that they gave? So with Google opening up, and there is WebMDs and all these clinical information in the space, Google space or web space, everybody started really become aware of what it is that they're getting, right? So that's what drove the whole consumer experience. Now, this is on the outpatient side. Then there is a whole inpatient side we're going to talk about. But then the improving consumer experience became a focused driver to really create a lot of backend efficiencies, creating a lot of data exchanges, building a lot of good guardrails around our data so it doesn't get taken out of context, and then be able to provide the consumer with that kind of a retail-like experience that they started really experiencing and wanting to experience in healthcare. So, at the bottom, you will see the whole growing use of advanced technologies, whether it is advanced analytics, whether it is AI-led automation or intelligent automation, whether it's blockchain, so on and so forth. All of these really started taking a front phase in healthcare to kind of build the new innovative models of care. So let's go on to the next slide, please. So this is the slide in the post-COVID, how this is going to look and how this is segueing into what Anupam is going to talk about. So really, with the COVID hitting us this year, what we really experienced on the left-hand side, if you notice, the first and foremost, it didn't matter if you were from US or India or some other country. Every one of us really experienced that the health and human safety became primary in our lives, supreme importance. And in order to do that, we needed to keep a physical and social distance. We needed to have access to PPE. We needed to have access to critical care because a lot of the patients across the globe, about 600,000 patients that were, have been hospitalized, and many have passed on. So the whole access to critical life-saving equipment like ventilators, etc., that needed to be there. Hospital beds not ready. Hospitals not ready. So all of these kind of was, we were all confronted with the fact that we really weren't ready for this pandemic in any shape or form. And the last but not the least, on the left-hand side, if you look, the resulting impact of this COVID, we started seeing the emerging pattern. A lot of these patients that got into steroids while they were critically ill with COVID ended up having organ failures. That was a pattern. So for that organ failure, whether it was kidney failure or heart failure or liver failure, they need long-term care. It's an irreversible condition. Or they needed, some of them were on chemo. Elective surgeries reduced very significantly across the globe. And any kind of procedures that needed to be done that could be postponed, got postponed. So healthcare facilities across the globe saw a significant drop in revenue on one hand, and a significant rise for demand for healthcare to really take care of the COVID patients. So this was a kind of opposites, right? And then another thing we noticed is the dialysis frequencies got reduced to the, we don't know what kind of harm it would have done to the patients, but it did start we did see the reductions in that. Mental health really took front and center. Isolation, fear, anxiety, depression, lack of jobs, loss of jobs, all of those, the fear of all of this really started, bothering people. So these were the things that we saw became the problem statements that really was making us explore and drive very quickly, adopt digital technologies, and then find different ways to address the patient population. So the main one on the right-hand side, if you see the contactless care, the first thing we needed to address to really be able to continue to see patients outside of COVID is to find ways to see them remotely, virtually, digitally, not touch them, not get them into the clinics. How did we do that? So telemedicine has been there for a while, but it really was not well adopted by the caregiving community. Suddenly, we started seeing that we needed to kind of get. I see somebody has got a hands up. I'm sorry. Or is it my hand that is up? Okay. So what we started seeing is in telemedicine, doctors were not used to seeing patients virtually. So they would have a EHR system, they would have a telemedicine system. They were going back and forth. They really didn't know how to kind of synchronize the two together. The patient ended up feeling not so great about it. So we needed to find different ways to care for these patients. And how would that look? What kind of experience do we need to do? How do we really create a seamless connectivity or integration of our backend systems so the patient does feel satisfied with the care? So this was the first exploration we started doing. And then we had to make sure for those patients in rural areas, elderly patients, that labs and all these ambulatory labs, etc., went to their homes. Chemo buses, any of the mobile ways to care for the patient where they are located became the primary importance. Second one, when patients started getting admitted, maybe they were in a different city, they got COVID, they got admitted, they didn't have access to data. Real-time data exchange had to happen in order to make sure no medication was given that would be harmful to the patient. Last but not the least, the topic for today, creating the sentient experience. So this is important from an outpatient perspective. If you go to a clinic, that itself is a big area for us to address in order to create a virtually seamless, human-like experience where the patient and the physician has that level of connect. But beyond that, in the hospital, what we realized is there was an extraordinary amount of anxiety and fear for the patients as well as the care providers. So we needed to create, because everybody is covered in PPE, there's negative pressure rooms, patients on ventilators. How do you really touch the patient and then tell them it is going to be okay, you're going to recover? How do we create that experience? How do we give the control back to the patient? This is where the whole sentient experience comes in. And this is the conversation for today, where Anupam is really going to walk us through some of the platforms that he has developed over the years, but more so now with the use of conversational AI, how you really give the control back to the patient, reduce anxiety, give him the feeling of being in the milieu of the hospital so they don't feel isolated, and then be able to receive the care. With that, I'm going to pause and I'm going to hand it over to Nishit. Nishit, are you on? I think he's muted.
Yeah, you're muted.
Okay, you left me speechless, may I say. Thank you so much. Very, very nice. It was quite something, actually, and one we can all relate to in these times. It's all over the place. It's a daily, scenario being pressed in front of us. So thank you for that. And, all this talk about contactless is now making me wish for a touchless root canal treatment, when I go visiting my dentist. Okay.
That's not going to happen, Nishit. I'm telling you, that patient will have to endure it. Maybe they'll be touchless in the sense of having PPEs, but I don't see. Maybe in innovation we can do something, explore to that effect with a healthcare client of ours.
We've learned a lot, Jay. So tell me something. What did you unlearn during lockdown?
Really, the unlearning was, how do you really care for patients digitally? I had never known how to care. Even though I'm in the technology business, I'm also a clinician, and I've never really felt like adopting telemedicine really fully. I never embraced it wholeheartedly. I will be honest, and I will admit it here on this call. It has been a difficult journey for me. So it is really difficult to understand, how do you really relate to a patient without, feeling like you're far away. And that has been a big thing for me to unlearn, that I can really see the patient.
Thank you for that, Jay. And pleasure to invite you, Anupam. Anupam is the founder and CEO of Sempia, and he'll commence this part of the show. Warm welcome, Anupam. And maybe I can quickly ask you, while we have you, before you start, tell me one thing. What is that one thing that made you happy about the lockdown?
It's a tricky question. I mean, the world has seen a lot of suffering in terms of loss of human lives. There have been lots of businesses. Somewhat instability has cropped in many countries. But one thing that has really happened in the last maybe 3 or 4 months is the speed in which the digital adoption has taken place. I was reading an article in Forbes, and it says, what we were projecting to be what companies thought of the classical digital transformation in 2025 or 2030 is done in a matter of weeks and months. It's really expedited the process. And if there's one good takeaway is that, we, as part of Sempia, has been working on it tirelessly for the last 5 years. We had to convince, a lot of our clients in different, spaces, hospitals, and some of the other industries. And now, we get crazy number of calls and requests in order to, fast track the entire process. So, in a nutshell, this has really transformed the world in a very quick time, and the digital adoption is something which we're going to see across the board.
Thank you, Anupam. Onwards with your slides, please. And we've got
sure. Thank you again, Nishit. Yeah, thank you again, Nishit, and thank you, Dr. J, for the wonderful introduction of the Applied Innovation Exchange, and then giving the healthcare technology overview. This was really insightful. Now, I start with a quote from Eric Topol, a famous cardiologist, scientist, and author. And as per Dr. Topol, it is very difficult to remove the human component from medicine, the human touch, the ability to meet in person, and to and have a detailed, intimate discussion between the doctor and the patient really can't be removed. This is very critical. Having said that, the present circumstances also force us to think digitally. There have been a lot of digital technologies. From telemedicine has been really, been the talk of the town across, across the world, really. And that is where, how is this, seamless interaction between, human touch as well as digital processes and digital technologies happen together. And the goal really is to make the customer or make the patient feel that they're cared for at every moment. Previously, there would be more focus on more. The aim would be on giving more customer focus, and then it would be customer personalization, and then eventually it would be customer. Now we are planning to customer oneness, where the healthcare provider, the hospital, and the patient are working together in order to attain a common successful objective of the well-being of the patient. Now, Dr. J, and you talked about the sentient consumer. So who really is a sentient consumer? I've done some research, and a sentient consumer is somebody who feels scared at every time in their journey with the hospital, who knows that somebody is looking after them. And we are trying to achieve that sentient consumer space, which is so critical in today's world with social distances. If I look into the right-hand quadrant, the human touch is very important, as per we all know, especially in healthcare. But then there are this emergence of the digital technologies in the right bottom corner. And in this whole present day scenario has come the post-COVID environmental changes. The social distancing is extremely important in today's world. I mean, everywhere you go, not only in healthcare, we have to stand 6 feet apart. We have to take all the necessary precautions. And then there are these regulatory requirements, which the governments or the regulatory authorities want us to do. I mean, somebody asked me, how is the difference? How is my next visit to the doctor going to be any different? And I thought about it, and something struck me. If you can see, or if the doctor can feel you and touch you, and there are chances that you would never be able to see the face of the doctor because he or she would be wearing a PPE. And if you can see the face of the doctor, there are chances that he or she will never be able to touch you because it is on the other side of the screen in telemedicine. So the digital and the physical process will be intertwined with each other, and we'll try to work seamlessly to give a care experience. If we move on to the next slide. This is really, the theme of today's presentation, the Maslow's hierarchy. And it really thought, me and Dr. Jay and the officers, we were thinking, how has the entire, trajectory happened since the 1970s? In the 1970s, it would be about the cure experience. It was all about the doctor and the patient and curing the disease. But then, came things like, multi-channel customer experience, where the patient and the doctor met at multiple points, be it at the home, be it the nursing home, or be it at the hospital. And then with the emergence of the personalization and the digitization came the personalized experience. So now there is, EHR systems, HIS systems, all these triggers. Give the best experience, personalized experience to every single patient. Consider them an individual entity. But now we are moving on to experience, and this is a classical where the digital systems and processes and the physical interaction intertwine with each other, give a holistic experience to the patient and the patient's family, and then make them transform into a sentient consumer experience where they are at one and working together with the hospital and the healthcare institution. Moving on to the next slide. Yeah, so the Decision Labs is the company which I represent, and we have a series of digital AI products. We started primarily in the healthcare space, so my first few slides would be around healthcare, and then I would talk a little bit about the other industries. So in order to give a sentient customer experience, a consumer experience, it is very important to understand what really is the consumer feedback, the voice of the customer. And in order to capture that, we have a platform called Sempia, which is used by many, many hospitals around the world now in many countries. And we captured this experience of the patient throughout the journey, right from the time they walk into the hospital, or even before that, at the time of parking or at the time of booking an appointment, to seeing the doctor, the nursing experience, the laboratory experience, the radio experience. So we constantly track the patient experience, ask if they're fine or not, if they need any help. And in case a patient says any dissatisfaction, we try to resolve it through different kind of trigger systems. So this is a capture. Unless we know what is the requirement, it's very difficult to create a new experience. After capture, we have to rethink. Can we position ourselves differently? Can we go beyond the standard traditional perimeters of interaction of doctors and patients or other healthcare providers? And this is where we came up with the product platform called Live Service. And this is, again, expedited. We're supposed to release it at the end of 2020. It's already live service. This helps the patient or the attendant to connect to any department in the hospital through an easy touch of a mobile AI application. So this is really the social distancing, the contactless service is captured, in which be it a daycare patient or an inpatient, they need not reach out physically to any particular department. Everything can be done digitally, seamlessly. This is where it will replace the nursing bell concept of tomorrow. Okay, so nursing bells would slowly be extinct. You don't need the nurse to every time come to your room and you give a request to her or him, and then it becomes a bottleneck. Can we do it seamlessly? Can we digitally track it and improve the entire service management system? And then moving on really to redesign, to recreate a completely new space. And this is where the team has been putting a lot of effort over the last few months. We are creating a click help application in which, imagine this is a conversational AI platform. In anything which we need today in terms of information, we do a Google. But this kind of system, the mini Googles will pop up around the world, starting with healthcare and then moving on to hospitality and banking services. When I walk into the hospital, I will have a Google of myself for the hospital. The way I interact with the hospital, be it with the laboratory, be it with the doctor, be it with the nursing, the billing, there would be a seamless connectivity with the conversational AI platform which we are developing, and we see a huge interest in the healthcare community. So starting with this Sempia, this is what we talked about, capturing at every stage in the journey through the different digital channels. This is a multilingual, so it is in 18 languages. So we capture from the receptionist application to kiosk application, tablet application. We also see a lot of QR code, which is maybe again, this is a very new development. A lot of the hospitals have requested a QR code based customer feedback, a customer suggestion system in the hospital. Again, this is contactless, digital, AI driven. We also have a nursing desk application. So all of these endpoints of service points of the within the hospital are enabling point where the patient can express their feedback, the suggestion, the complaints or compliments. Post discharge, they have SMS and email. Again, I might have missed inside the room. They have all these tablet applications, and as all of these are digitally captured throughout their journey, there are real-time insights generated. There are real-time workflows that are created in the backend. And again, it is very important that those complaints, those feedbacks are seriously taken care of so that we can rethink and design the entire experience. Now, moving on to the next slide, once these feedbacks are collected, this is a seamless process which works in the back end. And now, dozens and dozens of hospitals use Sempia in order to capture the experience, make sure every patient is satisfied. At the end of the day, these are, three simple words: satisfied patient always. That is the core of the application. There can be AI, there can be digital, but we want to make every patient satisfied. We want to empower the patient to express their needs, because patients feel very helpless, attendants feel very helpless in the hospitals. And that is the space where we can make a huge difference with technology and AI and really creating the like a sentient consumer experience. This is the time to rethink. When patients are complaining about a particular service, can I give a better service? Can I plug any particular point in my entire service excellence journey to give a better experience to the patient and the patient's family? Moving on to the next slide, and this is where we rethink, and this has been developed quite fast-tracked in the last few months with my team, and I'm grateful to them that they have developed live service where the patient can reach out to all these different departments through a QR code. a live service, a mobile application, a tablet, and a call. Everything is digitally recorded, and everything, we track it, and then all these reports are generated, and then workflows are created for an AI system. So I do not need to physically meet any officer in the hospital. Everything can be done digitally, seamlessly through a remote service management application. This gives convenience to the patient, empowerment to the patient. The patients feel more empowered. They can reach out to anybody, anytime. They can track their service request. Imagine you've requested maybe a bed sheet change. You can actually track what is the status. It's already 24 minutes. It was supposed to be delivered in 20 minutes. You can create a reminder, or the system itself will create reminders. And this is revolutionizing the entire healthcare space, where we put the patient at the center of attention and completely rethink the way customer experience. Hospitals are dismantling the nursing bell concept, and it helps them to give better resource planning. Hospitals exactly know where are the complaints coming, where are the service requests coming, who is looking into it, can I increase my manpower, can I readjust or reshuffle my manpower, and so on. Moving on to the next slide is where the team is working really hard on the Click Health conversational AI application. Imagine you walk into a hospital and you are lost. Quite often in big hospitals, people are lost. Where do they do the billing? Where do they give the blood sample test? Which room is the doctor sitting? Where is can I book a reappointment with the doctor? Or if the doctor is late, what is it with the doctor? Quite often in today's world, even there is no the may I help you is also very restricted because of social distancing. The may I help you, sometimes there is no manning of the desk in the late hours in the night or on Sundays. But we have to empower the patient and yet give a smooth experience to them so that they always feel that they're cared of. And this is very important, not only for their immediate need, but for their well-being in the future, how they will, perceive healthcare, and how they will, their entire thing of the diseases and all we have seen through different brain prompt frameworks, that if they're really cared for, their recovery happens really fast. So here there's a conversational AI where either I'll just take 30 seconds more on the last slide, but either the system automatically gives them the response. So if I want to collect my blood sample, I put a question on the application and it automatically redirects me to the sample collection room, or it can also help me to interact with the coordinator. Quite often, the patients do not know how to book a tele appointment, or when is the doctor coming next, and sometimes it is people are clueless because there are many visiting doctors. And here is where we create this interactive system. Now, as we have already worked with a lot of healthcare institutions, something strange happened like 3-4 months back. A lot of hotels and hospitality sector have come to us, and they have said, hey, can you do something for us? And these are really big chains. And they say, we think that when COVID is over, hopefully soon, the way the hospital industry will work will be completely different. And so can you recreate the experience, and so that I can also do cost optimization as well as give a great experience to my guests. And we are also working on redesigning this entire guest experience for different hotels. And this is again, many other industries have reached out to us where we do things like contactless check-in. The Hiltons and the Marriotts of the world already have it, or a remote ordering for the food. But can I make it more democratic? Can it be the new norm and not just the top 1% elite using it? So we want to democratize the entire process. Find directions of business centers, book gyms in hotels, or request a sightseeing. The entire concept of concierge desk maybe vanished when post-COVID. The bellboy concept and things like that. And can we make it seamless, contactless, with social distancing, yet give an excellent customer service throughout the journey? And moving on to the next slide, just today morning, I was, with one of the biggest banks of India, and, and there was a confusion because there is something called this ticketing system where you walk up to a system and you say, okay, I need an account information, or, my debit card related information, and the token would come out, and then you would be called in one of the counters. But because of these, contactless things, that system was not working. Now imagine, instead of all this paper coming out, can we have a digital queue management system? And that will revolutionize the entire industry. We don't need papers to come out and tokens and screens to be visible. It will beep automatically in my phone once my turn comes with the with the number of the counter number where I need to go. So we also see a lot of banks, from Europe to Far East in Asia. I know a lot of banks and financial institutions reach out to us and say, hey, can you help us in our customer experience? Because very less amount of people are walking in, and if they're walking in, there's a lot of confusion because of social distancing. So again, things like live service, things like ClickHelp and Sempia together will create a holistic experience in the banking, insurance, and financial services industry. For the retail space, very, very interesting concept. I was discussing with one of the huge retail majors, and they were saying, customers are terrified to enter our store. Yes, we do have an e-commerce platform, but what do we do, to engage with the customer more? Can we create something where the customer can see the stock inside the retail store even without visiting the retail store, or can exactly know if a particular item is present in the store, which means, Google it up, see the availability of the item. If it's a fashion item, see the composition of the fashion item, check out the price, check out if any discount, and this will completely transform the experience. So we are all moving towards a world which would look very different. 15, 20 years back, the concept of Google and Facebook and maybe WhatsApp and things changed the world in the last 15 to 20 years. Now is a time when we will see the next level of Googles and Facebook and WhatsApp of the world will come up. This will redefine the entire technology space, be it in healthcare, be it in hospitality, be it in banking and insurance, or in retail space. And this is where we are driving towards, and we are really thankful, Nishit and Dr. J and Suvarna and Ravina and everybody for giving us the opportunity to present a new world where things will be very different than what we saw till February. Over to you, Nishit.
Gosh, is there anything that you've not thought of, Anupam?
Yeah, I mean, the world is constant. Even when I was checking into the office today, they have a contactless, so nobody's pointing at me. The thermometer, which was 1 month back, now even that technology has changed. So there was a contactless ray. It checked my temperature, and the person behind me had 99 plus. And he was automatically stopped, and then somebody came to check him from behind. So there was no person manning the desk. It was a contactless digital check. It was a contactless, this hand wash process. And then I had to show my app of the tracing app, the Arogya Setu, which we have in India. And it said that I'm safe, and I was allowed automatically in the office. So, again, this was not there when we last talked 15 days back.
Outstanding. And that was obviously very powerful, all that you presented and spoke about. What gets you in the context of CX, particularly when you spoke about a human desire to speak to, a form that looks like a human, right? You're wearing a PPE, you're not really visible. Although if you're behind a screen, you can see but not touch. Where is that synthetic world of the real and the virtual, right? What and there's a reason why any robots, for example, in the consumer space will have the shape and form of a human, the cyborgs or whatever. And whereas in a manufacturing facility, there'll be, robotic arms doing their thing. But anyhow, thanks for that. There's a lot of questions coming in, Anupam. I think we'll have to give it to Suvarna to pick out some of those and respond. We'll respond to those questions. Jay, if you want to come back on the screen, please. Thank you.
Yes.
Thank you, Nishit. Thank you. Thanks so much, Jay and Anupam. That was an awesome journey to the sentient story that you put together. There are some very interesting questions that we have got in our chat boxes. I'll have to check whether this is one question that which Jay will pick up or Anupam. This question says, how far the regulators around the world are adjusting their frameworks to be open for innovation in the healthcare, especially around technology adoption. Do you see any challenge?
And Anupam, you can go next, but I'm quickly going to say I am very intrinsically ingrained in the US federal and state and county level regulations in healthcare, and I have been for the last 27 years. And I'll tell you, the time has never been greater than now in order for technology adoption. CMS, which is Centers for Medicare and Medicaid Services, which is a federal organization governing body, releases the regulations every year. And they are completely on board in really bringing bringing up the latest and the greatest. They throw out innovation challenges with prize money in it to come up with the best discovery. So healthcare innovation, healthcare startup in US and across the globe, even in India, I've seen that is very much alive and thriving today. So regulators are very open to trying out new ways to bring in the digital technologies in healthcare.
I think that answers the person who's put the question pretty succinctly, Jay. Anupam, do you want to add on to it, please?
I mean, the classical word is necessity is a mother of invention, but now necessity is a mother of regulatory flexibility. Right? If I look into, the telemedicines of the world, or if I look into any of these, I mean, there are banking processes. As I told, I went to the bank today, and this is a real life story. There is something called an extension of the PPF account, and it could not be done without your physical presence. But government has waived it off. Now you can actually email it to the branch, and your PPF gets extended, okay? And that's a small thing, and that's in the banking space I'm talking about. So I'm saying everybody's getting flexible. The work from home concept in itself has been completely transformed in the late March. Within 7 days, governments have given permissions, be it healthcare, be it IT, be it BPO, all the industries have given a green flag to work from home. I do not think regulatory will be a really hurdle going forward, because everybody understands the world is changing really fast.
Absolutely well said, Anupam. This particular question is directed towards you, Anupam, specifically.
Sure.
It says, since sentient consumer experience requires collaboration among multiple stakeholders, do you think it becomes more important to understand the social relationship between physicians, hospitals, labs, etc., through social network analysis and how they influence their beliefs and behaviors?
Well, absolutely. I mean, see, innovation is not of the few and privilege. It's not of the privileged few. This is the need of the hour for the very survival of humanity. And be it physicians, be it collaborators, be it healthcare practitioners, leaders, patients, attendants, in whatever way and form, nature will find its own way, in order to collaborate and to have an optimal survival environment. So I think definitely all of us understand the need to change, the need to readopt, or to rethink the way we have done things, or relearn and unlearn a lot of things and relearn. And I think this is definitely the way forward, in which there is social collaboration, because all of our behaviors will change. Even if we don't want to change, it will change. And the only way that we can all move forward is we collaborate together in healthcare as well as in other industries.
So like they say, change is the only constant. Please embrace it.
Absolutely.
Fastest the better. So thank you so much, Anupam. There are some great questions out here, but we have actually run out of time, and we are top of the hour, almost there. We'd like to let our audience know that these questions can be put up in the link where they've registered, and we'll be very happy to come back to them with the relevant replies to the same. It will be great to have connected with the audience going forward, even beyond this session. And last but not the least, couldn't thank the panelists enough for taking us through such a relevant journey onto a story which is absolutely fitting and absolutely relevant to all of us, irrespective of whichever way or whichever profession we are into or personal lives we are into. Plus, Anupam, the great piece that you brought onto table about this piece going beyond healthcare onto other sectors as well. I think those were really key points and key takeaways for all of us. For me particularly, sure, I can call that out really loud and clear. And would love to get on to a session like this on another dynamic topic soon. Take care, be safe. See you around very soon going forward. Thank you all. Thanks so much.
Thank you all. Thank you.
Thank you, everybody.
Stay safe. Thank you.
Pleasure.